The world of healthcare, it's always shifting, isn't it?
Constantly evolving, yeah.
And one really big trend we're seeing, tracking actually, is this growing need for different bits of the system, the places you go for care, to actually talk to each other better, to work
Hmm.
together more smoothly.
Less like separate islands. That fragmentation, it's a real headache, not just for the clinicians trying to coordinate things, but also for you as a patient trying to figure it all out.
Definitely. Getting everyone on the same page, it's just crucial.
Hmm.
And today, we're doing one of our deep dives into a really, really critical relationship within primary care.
Yeah.
That connection, or let's be honest, often the lack of connection between your local community pharmacy and your GP practice.
Yeah, it's fundamental. We've been digging into some recent stuff from Community Pharmacy England,
Yeah.
NHS England, and also the Pharmacist magazine.
Right. Trying to understand where things are and maybe more importantly, where they're supposed to be heading.
So our mission today really is to unpack the main reasons why there's such a push to bring pharmacies and GP practices closer. And, crucially, how things like digital tools are meant to make that happen.
What are the key things you really need to know to understand this whole shift?
Exactly.
Okay, let's get into it then. If we're talking about that digital handshake between pharmacy and GP practice, the sources seem to point towards one main piece of technology.
That's right. The core mechanism everyone's talking about is something called GP Connect.
GP Connect. Okay. So based on what we've read, what exactly is it? What's its job in linking these two?
Well, you can think of it as an NHS IT service. It's specifically built to allow sharing. So it lets GP practices and other, authorized healthcare staff.
And that now includes pharmacy teams, right? That's the key bit.
That's the really important development, yes. Relevant pharmacy professionals. It lets them share and view electronic patient records, appointment info, that kind of data directly between their different computer systems.
Okay, so it's about breaking down those digital walls.
Precisely. It's the digital bridge, if you like.
Got it. And the sources, they focus on a couple of main functions within GP Connect that are, well, most relevant for community pharmacy right now.
Yeah, spot on. For pharmacy, the two big ones are access record and update record.
Access and update. Makes sense.
Represents that two-way flow of information we need.
Okay, let's start with access record. The name kind of gives it away, but this is about the pharmacy team seeing info from the GP record.
That's it. Access record lets authorized pharmacy staff view parts of a patient's health record, the one held by the GP practice.
And there are different types?
Yeah, the articles mention a few, like access record, HTML, or access document. But the one that pharmacy IT systems are really focusing on integrating right now is access record, structured.
Access record, structured. Okay, that sounds organized. What kind of information does that one give pharmacies access to? What do the documents say?
Right, and this is where it gets really practical for the pharmacist. Access record. Structured gives them integrated access to key bits of the record.
Yeah.
So things like
Medications.
definitely medications current and past. Also, uncategorized items.
Uncategorized. What falls under that?
It sounds a bit vague, but it's actually really valuable stuff. It captures important measurements and maybe lifestyle factors that don't fit neatly elsewhere. Think like weight, height, BMI, pulse rate.
Oh, okay. Vitals and things.
Yeah, smoking status, alcohol intake, blood pressure readings, really useful context. And also certain investigations.
Hmm. Having that kind of structured data real time must be incredibly helpful when a pharmacist is advising someone or providing a service.
Absolutely.
How does it stack up against, the older ways pharmacists might have seen some info, like the National Care Record Service, the NCRS, which includes the summary care record, the SCR?
Yeah, that's a really good comparison. And the sources do highlight the differences. They say access record. Structured is designed to be real time.
So bang up to date.
Exactly. The data is structured, which means the pharmacy computer systems can understand it and use it directly in their workflow. It's properly integrated. And importantly, the information isn't necessarily limited to just, say, the last 12 months, which could sometimes be a limitation with NCRS SCR.
Right, so it offers potentially a deeper, more integrated view for those specific types of data it covers.
That's the idea, a more dynamic feed.
And the initial rollout, it's tied to a specific service.
Yes, the sources are clear. It's initially being used alongside the pharmacy for service.
Which makes perfect sense.
Yeah, giving pharmacists access to relevant GP info when they're seeing patients for those common conditions, it just fits.
Okay. Now, access record. Structured give access to those key things, meds, measurements, investigations. But The articles are also really, really clear that pharmacy teams shouldn't just rely on this, right? There's a crucial safety point here.
Absolutely vital. Cannot stress this enough. Teams must continue using other sources, too, like the NCRS SCR and Shared Care Records, SACRs, where available,
For what specifically?
for additional clinical information. And the big one they highlight is allergies. Allergies might not be reliably pulled through GP Connect structured data yet.
Right, so check NCR SCR for allergies.
Yes. And also, if the information they expect to see just isn't there in GP Connect, or if they have any doubt at all.
Ask the patient. Call the practice.
Exactly. Consult the patient, pick up the phone to the GP practice. GP Connect is a powerful new tool, but it has to be used as part of the bigger picture of information gathering, not replace everything else.
That's a really important clarification. Okay, so access record is about pulling data from the GP. What about the other way? Update record. This is the pharmacy sending info back.
Precisely. Update record allows those authorized pharmacy professionals to securely send information into the patient's GP record. It closes that communication loop.
Makes it a two-way street.
Yeah.
And do the sources give examples of what kind of information gets sent back?
Yes, they specifically mention consultation summaries from services like Pharmacy First. That's a big one.
So the GP knows what happened in that consultation.
Exactly. Also, info from other pharmacy-led services, like, say, blood pressure check results or details from contraception consultations.
Okay, so it ensures the GP is kept in the loop about significant clinical stuff happening at the pharmacy.
That's the goal. Informed GPs.
Right. So we've got the Tech GP Connect, the key functions, access record for viewing, update record for sending back. Now let's really dig into the why. Why is making this digital link happen seen as so critical? What are the big benefits, according to these sources?
Oh, the benefits listed across these documents are pretty significant. They cover both the healthcare teams, the professionals, and fundamentally you as the patient. It's really the driving force behind this whole push.
Okay, let's break that down. What about for the professionals first? The GPs, the pharmacy teams, how does it help them?
Well, a major one that comes up again and again is reducing burden.
The admin burden.
Exactly. For pharmacy teams, having integrated access means less time wasted clicking between different applications or logging into separate systems.
Streamlines their workflow.
Yeah. And more broadly, for both sides, having this digital connection promises to cut down massively on the need for phone calls or, sending emails back and forth just to check simple facts.
Like checking current medication lists.
Things like that, yeah. Which should, in theory, dramatically decrease the admin load on both GP practices and pharmacies. Time saved chasing information is time that can be spent on.
Actual patient care.
Precisely.
That administrative drag, we hear about it constantly. It just eats up time. But beyond saving time, how does this connection actually impact the, quality and safety of the care itself?
That's arguably the most important why. Accessing that real-time, structured patient info directly through Access Record should dramatically improve clinical decision-making right there in the pharmacy.
Because they have a better picture.
Exactly. It reduces clinical risk. If the pharmacist has more complete, up-to-date information, they can make safer choices. It should lead to better patient outcomes.
Fewer errors.
Hopefully, yeah. Minimizing errors that might happen because of incomplete info or just relying on someone's memory, which isn't always perfect.
And for the patient, you mentioned benefits for us too. How does this make things better when we use these services?
Well, it really helps create genuinely joined-up care. It means your pharmacist can, say, verify your medication history without always having to rely on you remembering every single detail perfectly.
Which can be hard sometimes.
It can. So it reduces that burden on you, the patient. It means the different professionals you interact with, your GP, your pharmacist, are increasingly working from the same shared information base. Your care pathway should feel much more connected, less fragmented.
Yeah, that makes sense. It sounds like it could also support a more proactive approach to care in the community.
It absolutely could. With better information access, pharmacists are better placed to offer more informed, timely advice and care. It really enables them to proactively manage patient health in a way that's much better coordinated with the GP practice.
Improving that cross-professional NHS care.
That's the idea. Working together more effectively.
And smoother processes for specific things.
Yes, that comes up too. Having integrated access helps ensure that certain services, maybe things delivered under patient group directions, PGDs, can be done more safely and efficiently because the necessary patient history is right there.
Less risk involved.
Right. And it also helps ensure those important post-consultation summaries, like from Pharmacy First, actually flow smoothly back into the GP record where they need to be seen. not lost in an email inbox.
Okay, so the why is pretty compelling. Less hassle for staff, safer care, better results, and a more joined-up experience for the patient. Loads of potential benefits.
Definitely.
Now let's shift to the how. Making the technology available is one thing, but how is the system actually trying to make sure this connection gets used properly, consistently, everywhere? The sources mentioned a really significant change involving contracts.
They do. This is a big development.
Yeah.
The NHS England and the pharmacist pieces highlight a major change in the GP contract for 2025-26. It actually introduces a mandate.
A mandate? Wow. Okay, that's quite a strong word in this context. What exactly are GP practices being required to do, and is there a deadline?
Yes, the requirement is very specific. By no later than October 1st, 2025. So a clear deadline, GP practices are required to make sure the GP Connect functionality is enabled.
Enabled for what specifically?
For two key things. First, enabling read-only access to patients' care records, specifically Access Record HTML, and structured for other NHS-commissioned providers. And that explicitly includes community pharmacy teams for direct patient care.
So opening the door for pharmacies to view.
Yes. And second, allowing registered community pharmacy professionals to send those consultation summaries directly into the GP practice workflow using the update record functionality.
So enabling the receiving end, too, October 1st, 2025. That feels like a line in the sand.
It does.
And did the sources give any context on why this mandate is coming in now? Was there, like, a problem before?
Yes. Particularly, the pharmacist article touched on this. It mentioned that this mandate follows a period where, apparently, some GP practices had actually switched off the update record function.
Switched it off. Why would they do that?
Well, the article suggested it was due to concerns from some practices about it creating a kind of workload dump.
Like getting too much information flooding in from pharmacies.
Potentially, yeah. An influx of information they perhaps felt they weren't equipped to manage efficiently within their existing workflows. And this reportedly meant pharmacies and GPs sometimes had to revert back to less ideal methods, like using NHS mail to share info.
Ah, okay. So the mandate is kind of a direct pushback against that, ensuring the system has to accept these updates, so the intended benefits of that two-way flow can actually happen everywhere.
That seems to be the clear message. Is the system saying, look, we need this collaboration infrastructure to be active and available. Here's the deadline, creating that contractual obligation.
Makes sense. And what about the rollout status from the pharmacy side? The IT suppliers getting this built into their systems. Community Pharmacy England gave an update, didn't they?
They did. It notes that the integration of access record, structured by the pharmacy IT suppliers, is actively happening now. It varies a bit by supplier, though.
So not everywhere yet.
Not uniformly, no. Some suppliers are apparently in early testing phases with certain pharmacies.
Yeah.
Others are further ahead. It mentioned one supplier, Sonar Informatics, was actually already live for all its users as of late May 2025.
Okay, so it's progressing, but maybe patchy still, depending on which system your local pharmacy uses.
That seems to be the picture. Integration is underway.
And Community Pharmacy England, the body representing pharmacy contractors, what's their take on all this? Are they behind it?
Oh, absolutely. The CPE source makes it clear they strongly support the rollout of GP Connect. They see it as a really crucial step forward.
For safety and workload.
Yes, exactly. For improving patient safety and helping to reduce workload pressures in pharmacies. They view it as essential for giving pharmacists the real-time information they need to provide better, more informed, and timely care.
Right. So let's try and pull all this together then. We've got the technology, GP Connect, the specific functions, access and update record, the clear benefits efficiency, safety, joined-up care, and now this mandate pushing for universal adoption by late 2025. What does this actually mean for you, the listener, when you pop into your GP or your pharmacy?
Well, fundamentally, it means the system is actively trying, really pushing, to build a more connected primary care team around you.
Less siloed.
Hopefully, yes. These technical changes, these contractual requirements, they're all designed so that when you visit your community pharmacy, maybe for advice, a pharmacy first consultation, or just picking up a prescription, they will increasingly have access to relevant, real-time information from your GP record right there in their own system.
Making their job easier and safer.
And hopefully leading to better care for you. And just as importantly, when the pharmacy provides a significant service, like that pharmacy first consultation, the details can flow back electronically to your GP.
So everyone who needs to know knows.
That's the aim. A safer, much more efficient, and ideally a more seamless experience for you, where the different health professionals looking after you are better informed because their computer systems can finally talk to each other properly.
It really is about making that collaboration, that teamwork between your GP and your pharmacist, much more of a day-to-day reality in your community.
That's the vision, yes.
Okay, so just to sum up this deep dive then, we've seen that GP Connect, and specifically its access record and update record functions, is the key digital tool being put in place to bridge that information gap between community pharmacies and GP practices. A new GP contract makes enabling this functionality mandatory for GP practices by October 2025. This is aiming to get past some earlier hurdles and unlock some pretty significant benefits like less burden for the professionals, much safer clinical decisions, and most importantly, more joined up, efficient care for you, the patient.
It really sets the stage, doesn't it? And what's fascinating to think about now is, okay, as this digital connection becomes standard practice, what happens next?
What new possibilities open up?
Exactly. What new kinds of collaborative services or maybe more proactive ways of managing health could emerge right there between your local pharmacy and your GP practice now that they can share information more easily?
That's a great question, and maybe the flip side, too. What challenges might still need to be ironed out to make sure this digital connection translates into truly integrated primary care that actually feels seamless and genuinely beneficial from your perspective as the patient?
Definitely something to keep an eye on and perhaps mull over as this rollout continues over the next year or so.